couple of things that are very important. First of all, a neurological disorder. That's very important because there are things happening in the brain of people with ADD or ADHD that is different from people that don't have these disorders. So the center, or like the cause, is in the brain, and it causes behavioral problems like not being able to pay attention, and also you have difficulties in social interaction. Not all people with ADD have this, but a lot of people have it because they just can't really keep up with everything. I don't know if you guys remember, but there were like 3 things in psychiatry that I talked about last time that kind of like the 3 levels. I don't know if you guys remember, but I'm always gonna get back to these 3 levels. So we have like 3 levels in which psychiatric disorder can manifest itself, and I don't know if you remember them, but I will I will repeat them, and that is cognition, conation, and affect. So I'm always gonna get back to this because it's very easy to kind of like understand. Thanks so much for the follow. To kind of like understand in which level. So cognition, everything that has to do with thoughts. So ADD is difficulty in organizing your thoughts, in planning and organization. And I'm gonna drop a difficult word here, and that is called executive functioning. Executive functioning is, it sounds very difficult, but basically it comes down to completing tasks. And every one of us completes tasks on a daily basis. For example, the easiest task is going to get a coffee. Okay, how do you do that? You go to the closet, you pick up your mug, you go to the coffee machine, you turn it on, whatever type coffee machine you have, you put the mug there, and you get nice coffee. But people that have difficulty in planning an organization, it can be quite hard for them to be able to complete that task. So for example, if you ask a child with ADHD, can you please get me a coffee? It can be that they go and they get the mug and they put it somewhere and the cat like is there and they're like, oh, cat, and they run away with the cat, and completely forgot about the fact that they had to go do coffee. So that's like a difficulty in organizing the thoughts, because normal people, they would just be like, okay, I get the mug, I go get coffee, hi cat, and they would just go on, The people with ADHD or ADD, that's difficult for them. Very important, a psychiatric disorder is always causing difficulty in everyday functioning and everyday life. This is something that is actually quite interesting, because ADD as itself, attention deficit disorder, isn't listed in the DSM-5 anymore as a diagnosis on its own. People that were here last time know what the DSM-5 is. The DSM-5 is basically like the Bible of psychiatry. Every single psychiatric disorder that is recognized and that exists is written in it, but ADD on itself is not in there anymore, but they changed it. So right now it falls under the category of ADHD, which is attention deficit hyperactivity disorder, and then they call it ADHD type attention deficit or something like that. So ADHD, very important, is a disorder that is characterized by externalizing behavior. Basically, externalizing behavior is everything that you can see on a person. For example, being very aggressive. People with ADHD, especially children, can be very aggressive towards other children. They kind of like, it seems like they're always having like a chip on their shoulder, so they're very explosive. They can be very loud. In class, they can't wait for their turn. They're like already screaming the answer. They find it very, very difficult to wait in a queue. They're hyperactive. They're like running all the time. It seems like they're constantly in overdrive, like constantly busy. Like they can't stop, and they talk so fast, and that is externalizing behavior. And of course, in ADHD, you have both things. You have attention and you have hyperactivity. So they have attention problems and they have a problem with being hyperactive. ADD, on the other hand, has the attention problem and very, very, very pronounced. But instead of externalizing, they're going to be internalizing. And internalizing basically means that they're mostly going to be like the child that is very reserved in class, like does not really say much, is not really there. They're mostly dreamy, but that can and that actually masks a lot of their problems, you know, because you can understand that someone that is like in overdrive all the time in class and like standing up and like throwing pens and all that, like teacher is gonna be like, maybe you should go to the doctor because like something's happening. But someone that's like kind of sweet, you know, kind of in the background, kind of like silent, and you know, does not really perform well at school or has problems like finishing tasks, you're just gonna be like, you know, this girl is reserved or this boy is reserved, you know, and it can be missed. So that's really, really important to know the difference between those two. That's also why I'm staying a little bit longer on this topic. I wanted to quickly define hyperactivity and attention deficit because those are very, very two different things, and it's very important to kind of like know what I mean with hyperactivity. It does not mean that you're like climbing in trees and, you know, you're very energetic, because then every child is hyperactive, but it basically sits in like very, very small things. Motoric restlessness, for example, you know, people that are always like, you know, they're just like constantly, like they constantly busy, like constantly tapping their leg, you know, or like they're doing things with their arms the entire time, or they stand up in a moment where they shouldn't stand up, you know. That's motoric restlessness, and it can be very severe or like very, very small or not even there, you know. So but that's motoric restlessness. Attention deficit, easily distracted, dreamy, difficulty showing in following instructions, completing a task, and also in organizing the task in their head, very difficult for them, loses things, you know, and forgetful. Obviously, the first thing I always say is we don't really know why these people have these problems. We kind of know why they behave like that, because to know behavior, you have to look at the brain, because behavior centers in the brain. Same with personality. It's all in the brain. So we know there must be something wrong with the brain, like maybe structural, maybe there are certain things missing or anything like that. There might be genetic factors, more with ADHD than with ADD. You have an increased risk if you have a sibling with ADD or ADHD or a parent, but it's not really proven, not as much as with autism. With autism, it's absolutely proven that you have genetic inheritance on it, so it's very important to know that. And then the second thing, like I said, imaging studies, and we found structural abnormalities, which basically means that we found that the brain in certain areas has a smaller volume, and that is mostly in the prefrontal cortex, which basically is like, as you can see in the image right there, and that is exactly where you can find executive functioning, where your personality is developing, where you organize your tasks and all of that. So it's very logical that if you have smaller volume of your cortex there, or you have something going on there, that it's going to be very, very difficult for you to complete these tasks. But actually medication is one of the last steps, as always, in psychiatry. The first thing to do is always parenting advice. Try and help the parents deal with a child that has ADD or ADHD. For the child too, behavioral therapy, how can you find less distraction, how can you complete tasks, you know, they give you all these tips and kind of like how do you call it, tools to be able to function better. eye roll, and if that really doesn't work, then we think about medication. I didn't list everything here, but like one of the most common things, it's very important to only take medication when it is specifically prescribed by a professional with license, because you're giving psychostimulants, you know, so it can actually cause you to go into overdrive, and it can dislocate certain psychiatric problems such as psychosis. So it's not something that is very innocent to just take. And then you have like the question, is it safe? Because one of the questions parents always ask when a doctor says maybe you should take medication, or like maybe your child should take medication for their ADHD, parents are always afraid, is it safe? Is it something that I should give my child, yes or no? Yes, it is safe when it is given with a lot of thought, and when the doctor really knows, okay, this is a candidate for it. And also when you get follow-up, okay? Not everyone can take these medications, because you have to have a thorough idea of the background, the medical background of the patient and of the patient's family, and you have to do some pre-test workup to be sure that there isn't anything wrong with the patient. Mostly reported adverse effects of the medication are headache, nausea, palpitations, so you can really get heart rhythm problems from it. Failure to thrive. So basically, failure to thrive is something that occurs in childhood, like mostly in early childhood, and it can have a variety of underlying causes, but if the medication, for example, causes you failure to thrive, it basically means that you have difficulty in growing and gaining weight. As you might know, children kind of like grow in the first year the hardest, and then afterwards like kind of like 10 centimeters per year or something, until they hit puberty, and then they can like grow 24 centimeters in a couple of years. So really important to know that. It's a very common problem in pediatrics, so know about that. That if you get Ritalin or something prescribed in early childhood, that it can cause you to stay small, and that's a very big problem for lots of people. So it can worsen your symptoms too. So it can actually make you more inattentive. It can make you more hyperactive if you have hyperactivity as well. And it can cause depression, anxiety, psychosis, all of these things. So it's very important to realize that it is not just a psychostimulant or like just a regular medication. It can actually have serious adverse effects, seriously can cause you problems, and can cause you to get heart rhythm problems as well. Okay, let us call Denzhy. You ready? And see if we can get her here.
Hi.
Oh, hi.
I've learned to laugh at my ADD and the things that happen, because sometimes, let's be fair, it's just funny. And it's one of the main things how I cope with it, is just not get too angry at myself, because sometimes you just can't help it, and sometimes it's just plain funny. Kind of everything you said sounded very familiar to me. And I do agree, like ADD or ADHD isn't the same for everyone, but everything sounded very familiar indeed. Yeah.
When was for you like let's just get to the start, you know, you as a child, how were you at school? How were things going for you?
I never paid attention. I was always kind of sitting in the bench staring out the window. I think one of the main reasons that nobody ever figured out that I had ADD growing up is because I kind of aced the tests anyway. You know, I didn't pay any attention, but I didn't have to, because I understood what we were on about. So, and it's the ADD thing. I didn't have the hyperactivity, so it wasn't too apparent that something was going on with me. And then I didn't fail any tests, so nobody was worried about me at all. So yeah, I was just not paying attention all the time. And one thing you said as well, which I recognized a lot before I knew I had ADD, the stimulus could get so much that I would kind of just, how do you say that in English? Afreageren?
that you kind of like, I don't really know. Google
Wait,
Translate.
I know this word, but now it's just kind of...
We'll go Google Translate.
Take it out. No, I would take it out on people. Like, I would get
no.
aggressive. Yeah, I would get aggressive. I would get impatient, and I would take it out. I would just be mean to people because something was overwhelming me. Like either people talking to me or talking too slowly, or something going on that tried to grab my attention away, you know?
Yeah.
And I would kind of just blow up and be aggressive and be mean to people.
Do you remember, like, maybe teachers or your parents or so sometimes saying, like, there was something up, or there might be something with you that is going on, we just don't know what it is?
Yeah, mostly everybody just kind of thought I was kind of weird because I didn't click too much with all the other people. I was always a bit of an outcast. I had maybe one or two friends sometimes, but usually I didn't really fit in. But everybody just thought, like, well, she's just a weird one, you know? And growing up in, like, the 90s, the 80s and the 90s, people didn't really know too much about ADHD or didn't do much with it.
No.
So that's sad. And whenever I was a teenager, around 14, since the age of 14, I've had depression as well. So probably because of the ADD, because I don't know what's going on in my head and I didn't know how to handle things. And even though like high school went fairly well, I didn't feel like I could do things like everybody else does, you know? So it's very frustrating. And especially when you don't know what's going on. I would just feel very lonely and very frustrated and also very angry at the world because the world didn't seem fair, and well, still, like, the world is a shithole, but like so many things happening that I don't agree with, and I take it all on me. Like, I nearly take everything personal that's happening in the world. It's like I'm very sensitive to a lot of things. So the sensitivity and the frustration and just feeling lonely because nobody understood me. Yeah. Not that they weren't trying, but like nobody knew anything about what was going on. So yeah. ADD for me, like in terms of what I'm struggling with, an attention span, not being able to do the things I want to do because something in my brain is working against me. Not feeling like I belong anywhere. Unless I find somebody with ADD and ADHD and then it's like, you're my people. Yeah. Yeah, and I'm sad that I didn't know this whenever I was younger, because whenever kids find out, they get diagnosed, they grow up with therapy and people give them tools how to deal with it and how to, you know, make the best out of the situation and take it, like, even it's not all bad. Like, I make it sound like, oh, ADD is terrible. No, but I'm super creative, and the bouncing thoughts in your head are also bouncing everywhere you want them to go, and you didn't think they would ever go. So you're super creative, and it's a lot of fun. And whenever I did take medication for a while, whenever they just found out. So in 2013, I think I got diagnosed. You said, like, the medication is like the last step. No, for me, that was the first step. They're like, here, get medicated, which was kind of sad. And then I got more focused, but I also got very dull. I got very monotone, and
your affect got kind of like flat.
Yeah, I wasn't me. I have it here, by the way, like the concerta. and that thing. But and then the medication was terrible, actually. So during the day I could perform like a normal human being, kind of. But then in the evening, whenever the medication stops working, everything you've been repressing all day kind of just hits you in one go. So like in the evenings, I was just floored. Couldn't do anything anymore. Completely paralyzed by all the things that you've been suppressing all day. So the medication definitely isn't the answer. No.
Yeah, and I think what for you, like what the problem was with you is because you got diagnosed actually quite late. You were 28, I think, when you got diagnosed, you said.
Yeah.
And you know, I still think and I still believe that a cornerstone of anything is always in combination with therapy, because you don't only suffer from ADD but also signs of depression, or you had depression or anything like that. So any doctor should have like presented the option of therapy, be it behavioral therapy or just, you know, therapy to get through everything. For me, like, that's really weird, because I think that is very important, or that could have helped you a lot. And a second thing might be the fact that they said, okay, medication, because maybe you had a lot of symptoms or anything like that, or lots of complaints. I'm not really sure when, like, how did the diagnosing process actually go for you? Like, how did it happen?
So I'd been going from therapist to therapist since like 14, mostly focusing on the depression and my not having no will to live, basically. But then, so there were all the, how do you say that in the eerste lijns?
Basically, like first line treatments, like GP or anything like that, or first line psychologist.
Yeah. And then I found somebody who did psychotherapy and clinical psychology. And they looked at me for like the first 30 minutes and like, let's do an ADD test. So that was at like 28. Yeah. And I'd been seeing therapists for all the time, and I already had some antidepressants whenever I was younger, like early 20s-ish, because that's what they thought. It was just depression. I kind of forgot the question now where we were talking about.
No, it's okay. Just
what we were on about.
Just drift. It was about your diagnosis process and how you got to where you are right now.
Yes, right. So I then at 28 went to the psychiatrist and we did some tests, which was basically just, and like, it was weird though, because those, if you read up on ADD a little bit, you could totally ace those tests. You could make it say whatever you wanted to say. But I was honest. I just like, okay, let's think back. And we talked a bit about it, but it was all like the psychiatrist. I got a diagnosis, and they said, well, go and find your own therapy now. Okay. So I was seeing this one therapist, but I moved cities, and my ADD and my depression kind of made it so I couldn't find the will and the energy to find more or another therapist or anything. So I've been kind of struggling to find proper help. Also, because my mind races so fast and I have so many ideas and so many things I want to do, sometimes I kind of overshoot, and I'm like, oh, but I can totally do this, like, it works in my head, so let's just go for it. And we're just gonna do this and this and this and this, and then I'm halfway through it, I'm like, wait, what the hell happened? How did I get here? And why can't I move anymore? And why can't I think anymore? Because then I'm just like overworked myself with all the impulse and excitement of the ideas that I have in my head.
You said something in the beginning, and it's also something that I noticed like the first time I met you, because I met Denzhy when we were doing a collab on a cosplay that I did on Instagram. If you're interested, you can go check out both our Instagrams to check it out. But you were like making jokes about ADD all the time. You were like, oh, like busy so long with this because of my ADD, and I was just like laughing because I was like, oh, funny, you know, she's like making jokes. But then, like, I don't know, at the end of the day you said, oh, actually I actually have ADD, and I was like, oh, really? You know? But you said, you know, humor is kind of like laughing at it, for me, is kind of like a way to deal with it. Is it really like that, or is it a shield?
No, I get that it looks like a shield, but I used to get so angry at myself whenever I failed at something. Like, I can't I don't have the focus to finish something, or like I forget. There's a cup of coffee in my microwave. I realize now, like whenever you started the stream, I was like, oh, let me get my coffee. Oh, it's cold because I forgot about it. Let's heat it up, and now it's there cold again in the microwave because I forgot about it.
Yeah. Difficulty organizing thoughts.
Which then I could get angry at myself for that. Like, oh heck, I just fucking hell, I can't even just get a cup of coffee already, you know? But it's kind of funny, right? Like I can get angry at myself, or I can just, oh, there she goes. Did I hurt myself with it? No. Was it really that bad? No. It's kind of funny, right? So laughing at it, with it, not even at it, like laughing with it, having some sort of fun-ish with it, keeps me from getting angry and frustrated at myself because I couldn't even do this, you know? I couldn't even manage this.
Yeah, I get that. But there are like lots of things that you can manage. I mean, you're streaming, you're having like amazing cosplays that you do and that you finish until details. Like it's really nice to see your cosplay. It's very inspiring, I find it. How do you experience that yourself?
Yeah, so that's just my online personality, right? So I show the finished product. Even streaming, I stream 2 days a week now if I can handle it, because streaming is very exhausting for me. I love it, but it's super exhausting for me. So I cancel my streams sometimes. But you only see the finished product. So it looks like I have everything under control, but I really don't. You only see the moments that I managed to figure something out, or I managed to finally put something on paper, on camera, under the sewing machine, whatever I did. The rest of the time is me struggling to get out of bed, to do something, to focus on life, wanting to live. It's yeah, you see the 10% that I managed to do something with my talents, with my interests. The other 90% is just a hellhole, if I'm gonna be honest. Like, yeah, so that's why it's very important for me to the moments where I can just have fun with it and just laugh at it and use the humor. It's very important for me to not be angry at myself all the time. Like, now I'm getting older, I am removing those people from my life that just don't take it seriously or think like it's not that big of a deal, you know? Because it makes me doubt myself as well, and makes me sometimes, whenever they are like that, it makes me think like, oh, maybe it isn't that bad. Maybe I am just like everybody else, and I'm just overreacting, and I'm just, you know, being silly about it. And that has happened to me, that I felt like, okay, well, just don't be so moody, and don't overreact. Just go and do your things, and then I overshoot again, because then I get the impulsivity. Yeah. Is that the English word?
That's the
that
word.
ADD has, like, and the energy that ADD and ADHD can have. I get that little moment where I told myself that it's not that bad, and I just have to like not overreact. And I overshoot, and I'm like way worse than I was before that. So I'm really just removing people from my life that don't take it seriously, don't want to listen to me. Yeah, definitely.
So what I hear you say is basically you get your feelings invalidated sometimes because people don't understand it. And it's very hard. It's very hard for people to understand that, especially people that are happy. You know, they're like, how is this, like, how can that be? Or they're like, you know, I have bad days too, and that's because these people just don't really know what it means to live with a mind that is constantly busy with things that it shouldn't be busy with, and part of it you can't really help. Like I said, you know, your ADD. Your brain is just wired differently than other people. That's just a little bit how it is. But that doesn't mean that you can't learn to live with it. But you have the second problem, which is the depression, which makes everything even worse, because now it's not only I have difficulty doing this, I also don't really know if I want to keep doing this, you know? So you're kind of like in the circle, and then you have like people that are supposed to help you, people are supposed to support you, invalidating all of those feelings that you're living with constantly. You have health professionals that are not really, or you feel like they're not really taking you seriously. And that puts you into a system that kind of like keeps itself alive, if you know what I mean. If there is one thing that you want people that are like watching, or they're gonna watch this later in a VOD or anything like that, that you want them to realize or understand or remember from this, what would that be?
For me, to other people, if I take something out on you, don't take it personally. I don't mean it like that. I just get overwhelmed. Sometimes if you know somebody has ADD or ADHD and they're getting cranky, it's probably not about you. It's probably about them not being able to handle everything that's like hitting their head. And if I can name a second thing, ADD can be fun. ADHD can be fun. We have good ideas. We're creative. Don't think that because we don't do things a neurotypical way, we can't do anything. It's just because we are in a society where everything is about the neurotypicals that we kind of get this label like dysfunctional, you know? But there's so many things we can do, and there's so many benefits, if I even may call it that. I mean, I would call it benefits to ADD, ADHD. I'm not upset that I have ADD. I'm upset that I never got the chance of properly dealing with it, growing up not knowing it, not knowing how to handle it and work with it. Because there's beautiful things in it as well, definitely.